This segment of Delmarva Life is brought to you by TidalHealth.
Far too many Americans have endured the shock of finding out they have breast cancer. As it stands now, 1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime. This year alone, an estimated 287,500 new cases of invasive breast cancer will be diagnosed in women in the U.S. Now, that could include your aunt, your sister, it could include a cousin, your mom, even you. And yes, we're talking to men too. Dr. Karen Barbosa of TidalHealth Breast Surgery specializes in the diagnosis and treatment of breast cancer, and she joins us in Historic Studio D. Thank you for being here.
Thank you for having me. Always a pleasure.
Thanks. So I want to start off by talking about risk. Who is at most risk for developing breast cancer?
So I'm glad you asked, because a lot of people think that they're high risk when they're actually not. Things that you should be aware of: any family member who's diagnosed below the age of 50 could have a genetic mutation. They should have had genetic testing if they had cancer that young. If they haven't, they should get it done. But you, as a family member with someone having breast cancer below the age of 50, should be thinking maybe you're at high risk.
Yeah.
So family member, family history is important. The other thing is, have you been exposed to radiation? Patients who've had lymphoma early in life had radiation treatments. There's also been a lot of agricultural and pesticides, and sometimes people have exposures. Those are weak associations. But these are all things that, you know, people won't know until they get risk evaluated. Dun, 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 dun.
Yeah.
So I'm happy to say we just brought in a risk calculating model to be implemented into our electronic medical record. I've been working very diligently with the staff to have that implemented, and basically every person that shows up, men and women, so thank you for mentioning men can get breast cancer, because they can.
Yeah.
We are going to be evaluating every person that walks in the door in the clinic to have a risk stratification in the Seaford location. It's going to be amazing.
Now, does that include the genetic testing?
So we are doing in my office genetic testing. When I risk stratify a patient and I find out that they are high risk, the probability of having a genetic mutation increases. And at that time, I will submit their pedigree that I generate, as well as my note, as well as a sample for them, and I get it done right in the office. So a lot of times we get that information before the patient even finds out what's going on. Most patients will present to me with a complaint of abnormal imaging, and that's where I start the ball rolling.
Yeah, and you know, statistics show that many women, and men, I guess for that matter, kind of put off the screening tests for breast cancer during the pandemic. How important is getting that annual mammogram?
It's everything.
Yeah.
I don't know how to explain it, but to say early diagnosis, early treatments saves lives. It is so dramatic that you watch the spike in the mammograms happening and the drop in breast cancer mortality.
Yeah. Now, as a breast surgeon, what is your role in breast cancer after it's been diagnosed?
Well, let me just say, at TidalHealth in the Seaford location, I'm building a pretty much brand new program where we're going to be creating comprehensive breast care. So I do a high-risk assessment for every patient that walks in the door. I do a genetic testing for everyone. I review their results with them. I give them a copy. I do a pedigree. I also do genomic testing, which is testing of the DNA if you've been diagnosed with cancer. We used to always recommend, if invasive, which means it can travel to other parts of the body, you automatically needed chemo. That's no longer true. We have tests where we look at the DNA of the cancer and we send it off to companies that can then tell us there is a benefit from chemo, there is no benefit from chemo. And it's huge. So I do that on the core biopsy, which means I get the result before we even make a full assessment as to what the next best steps are. In a patient who needs chemotherapy, I personally believe getting it before you go to surgery, shrinking the tumor, but also shrinking any potential nodes that are involved. Lesser surgery, win-win.
Yeah, absolutely.
De-escalation is the key in breast cancer care these days.
Sure. Okay, but then there's reconstructive surgery afterwards, and you're involved in that as well?
So, as my friend Nelson Goldberg, the plastic surgeon I used to work with, said to me, "You are a unicorn." So I am a hybrid, or the representation of where we will be going here in the U.S. Right now, the American Society of Breast Surgeons is actively teaching courses, and a lot of other companies are getting out there and teaching surgeons who are currently practicing how to fuse cancer surgery with plastic surgery. So setting up your surgery with a mind's eye to the cosmetic result at the end. And so we can do a breast reduction at the time of their lumpectomy. So women with large pendulous breasts are getting wide negative margins, reducing their need to go back to the OR for re-excision. They get to keep their breast, they get to keep sensation, and they look 20 years younger. Yes, please.
Yeah.
Patients are thrilled, and we have several patients that we've already done out on the Seaford location that are just pickled pink, just so excited.
Dr. Karen Barbosa of TidalHealth Breast Surgery, we're so lucky to have you. Thank you for being here. There are 2 locations, one in Seaford and one in Millsboro. Thank you.
Thanks.